Hey guys, welcome back to another wonderful episode of The Ramblings. I'm your host, Angelo Roberts. I bring with you today our special guest, Stephanie Katz. She is the CEO of SETA. It is a wonderful organization. We're going to learn a lot more about that, as well as some great stories. Introduce yourself today, Stephanie.
Thank you. I'm glad to be here. I am the CEO and founder of SETA Benefit Consulting Group, and we are located in the DC metro area.
That's absolutely wonderful. Now, so for a lot of people, they don't know what SETA necessarily stands for or even what a beneficiary group is. So we're going to do a lot of learning today because I really don't necessarily know. And so it's a great time to do a deep dive, guys. Put your thinking caps on. We're going to go in. So what is SETA? What does it stand for? And what is a beneficiary group?
So SETA is my company. And when you start a company, you always think, what do you want to call it? So it came to me one day. I was driving along at a light because I'd been thinking about it. I was launching my own company. And the letters CETA come from the four companies that I worked for before I launched mine in 1997. So I had been with Coopers & Lybrand, Ernst & Young, T. Rowe Price, and ADP Benefit Services.
Wow.
So it came to me and I said, I'm going with it. And I've gotten a lot of positive feedback on the name, but they always like to say, what does it stand for? So it's personal to me.
Oh, okay. We love personal names.
So what we do is we are in our 26th year and we provide custom solutions to meet HR and benefit needs. We did start out, the official name, as I mentioned earlier, is SETA Benefit Consulting. We started in benefits and probably over 15 years ago expanded into all of HR. Our clients span almost all industries and size. So we have clients where it's an owner hiring their first employee to companies that even have over 10,000 employees.
Wow, that's a lot of different people and organizations that you've worked with. So considering that we are a virtual assistant organization, we're going to get into a lot of HR questions. We do HR and everything like that. So I guess let's start one. What led to you starting your own company? You have your previous career history, but what led to you starting your own company?
Sure. So as I mentioned, I started with Coopers and Lybrand and moved on to Ernst & Young. At that time, it was the big 8 public accounting firms. And, we've obviously merged and we're much smaller now. So I had been with ADP Benefit Services, and that was a division that ADP, the payroll company, had set up. I was brought in to work as the right-hand person with the head of that benefit consulting firm, which had been acquired by ADP. And when they decided to disband and get rid of that division, my job had been eliminated. So as I looked around, this was 1997, I had young children, and I said, you know what? I want to be my own destiny. So I really want to work hard and do well. And I lost the control when I worked for someone else because they could easily just eliminate the job. And that was happening. A lot of the accounting firms were merging and other firms. So I said, you know what? I have an MBA from Wharton. When I was at Wharton, I had put together a business plan to start my own firm. So that the time was right. And I launched in 97.
Wow. So for a lot of the users that know in the audience, I was born in 97 and life was so much different, especially if you were just entering the business versus today. The internet is a much more prevalent kind of experience. What was it like to launch a business in 97 versus how you see people launching businesses today and what it's like for you running one now?
Okay, so I actually started in my industry in 1985. So I had a number of years experience and had looked at, partner tracks and the accounting firm, for example. So I knew that I could handle a company. I thought that with my young children, it would be an easier way for me to balance work and family. That was always something that was critical for me. At the time, I was married and we did have another income if that, had been an issue. So now launching, and I had also been on a national benefits board. So I knew people around the country.
Oh, okay.
which definitely helped. I was the youngest member of a national benefits organization board. So knowing people around the country gave me some ins, and having the business background, I said, I know I can do it. And the challenge is that with any kind of consulting firm, we picked niche areas. I did decide not to have employees, so that still is my practice today. That makes it a little bit simpler in running a company. I have contractors around the country, even one in Canada that I used for some projects. And so I said that would be my model. I'm going to have niche services, and I have contacts. Let me go ahead and start. But when you have your own firm, it's ups and downs. So our revenue was mostly on various consulting projects. And you would have a project and you'd finish, and you were, pounding the pavement for another one.
You have completely just changed the trajectory of this conversation now by saying,
okay.
Oh
That's
my
a good
God.
thing.
Yes,
But,
in a very good way. Okay, audience, I am going hyper focused, super like niche sensitive, because I now have a topic that I kind of wanted to talk about and had for a later date, but I think you're the perfect person to talk with this.
Sure.
So I come from a family of business owners. The audience already kind of knows that. My dad is in real estate. However, he has been in real estate since I was born. So he obviously, has a heap of much more business knowledge than I do. He, like me, when he was young, starting businesses, started with, like, say, a liquor store, a seafood restaurant, trying to find his way. However, he realized he doesn't like to work with employees. He never really liked employees. And he, before I was born, has committed to the same model of only wanting to work with contractors, because his belief is that they're their own boss. And so he wants people, or to hire people that also would like to be their own boss, therefore thinking that the work would be better. I want to hear your take on why you chose to have like that particular model, and how that's worked out for you.
Okay. So it's sort of the cart and the horse kind of thing, because I was launching, I didn't know, what kind of work would come in, and my name was known in the industry. And so I said, let me start this way. And the type of work I do, I'm constantly dealing with employees, because one of our big services is interim services. So if the head of HR, the head of benefits suddenly leaves, I'm in that seat. So I still was dealing with employees, but they were not mine. And so what I've been able to do is expand the diversity of the services that we offer, and bring top level talent to the work by going with the independent contractor model. So as I mentioned, I started out in benefits. I decided to expand into anything HR and benefits. So whatever comes up, you're trying to attract, retain, manage, engage employees, anything that a company needs in that space is something we can do. Maybe I cannot personally do it, but I am constantly out meeting people, and I can bring the right team to bear. And so that model I've continued, and it just, that way I'm not managing all of my employees for projects and managing employees, for my clients as well.
Okay, so do you have regular team meetings with these people, or are they like people that have been long term? Would you say you have a lot of turnover?
So what I have is I have contractors. So if we take on compensation consulting, that's an area that I personally do not have the deep bench in terms of expertise or surveys, because what we end up doing is benchmarking compensation. I have several compensation consultants that I have used over the years. I'm working with one. So instead of regular team meetings, what I do is I'm managing that project. So we have a couple of compensation projects going now, and the consultant that I have working with me on the project is somebody that I worked with back. I joined Cooper's early in 85, and she joined a few months later. So we've known each other since 85. We worked together on and off all these years. And so she has her own firm. And in fact, when I was at Wharton and I put my business plan together, we were going to go into business together. So we were laughing about it recently, saying, remember I did that? So she, I've been using her recently on some compensation projects. So
Funny how
I do
life comes full
people.
circle.
Yes, yes, it is. But she has her company, which is only focused in the compensation area. So if I have work that's compensation, I can reach out to her. Whereas I have other people. So for example, if it's the interim role and it's not something that I'm taking on, I have individuals that I can place with different clients as well. And some more
Okay.
junior people, depending on what it is. So.
Okay. If you don't mind me asking, what's like the revenue range that you guys are at right now?
We are, let me see, trying to think, probably about 600.
You have I have to show this episode. I'm going to show this episode before I air it to my dad, because you have completely shattered how I previously, because we literally just had an argument about that. And my exact statement was, you cannot build a real company without actual employees, because
Mm.
every business needs like people. No man is an island. And he says he does
But
not an
you
island,
also
1099.
asked what the difference is between launching in 97 and launching now. I'm constantly running into individuals that want to do this, where they want to align with others and go in because we want to provide more value to our clients.
Mhm.
So they would come in. So I structure, if people, bringing in a seated team, or maybe I'm part of the ABC company team where I'm bringing my expertise, but it's through their company. There are also virtual assistants. So like you'd say, oh, do you need that? Or I heard, Angelo, you had a great example yesterday where someone went out on vacation and they came back to tons of, what did you say, 7 days worth of emails.
Mhm.
And you were able to give them time back so they could focus on other things. So having those types of services available now would make it easier for people to not have staffing. I have
Mm.
always, though, and this is unusual, I have always had an outside office. So I'm not the kind of person that wants to work from home ever. And so that's a rent expense, but which is like a mortgage to me. But I'm not paying, employee salaries, thinking I may not have the right expertise of an employee, whereas I can always go. I did a project several years ago for the Maryland Transit Administration, and
Mhm.
it was in affirmative action, and those regulations are so specific for the transit industry that I went and I found people in California that had that specific expertise that became part of my seated team to do that project. I would have had to
Wow.
pass on that if I had employees and we didn't have that expertise.
Okay, so like what drove you to do an office, even though, do you work with your, like, say, people like in person? Like, do you guys meet in person, or is it a virtual experience? You said you've worked with people all around the country.
I do. Yeah, so most of my work is virtual. I'm out meeting people. I'm also on 4 different boards. So I'm constantly in and out of my office, but I just like coming to my office, even if I'm here 7 days a week, and feeling like it's an office environment and it's separate from
Mm.
home. I think when I started out, my children were very young and I had to do that. And then I decided I just like that. So even during COVID, I was coming to my office every
Is it
day, even though my kids weren't happy.
is it
But I
just
have
you?
what?
Is it just you in there?
Yeah, I have. I had always subleased. So when I started my company, I was subleasing space. Okay.
Mm.
And then I had moved a couple of times, and I ended up in 2006 subleasing and moving to a building where I still am, but I had space for 10 years, because one of the things is I provide the interim support. So sometimes with those types of clients, I actually have a physical office at my client site if it's a local
Mm.
client. And so I didn't need a lot in terms of space. And then we went to renew the lease. I had been with that person for 10 years. And I said, you know what? I'm giving up a couple of my offices at clients. I want more space. So I have an entire suite just for me. But it's nice. So if I wanted to bring people in, I could. I love the building, and my friend downstairs runs the deli, so it's a nice environment.
That absolutely is amazing. Now, one of the things I kind of want to dive into really quickly is that a lot of the people on this channel or this particular this podcast that are listening are first time not only entrepreneurs, but that's been like their thing since always. Like, yes, I've had other small kinds of engagements, but I never chose to go fully corporate. My background's in accounting. That's what my dad's like trade is. I always knew like that's a backup plan, if you will. And even then, that's not what I really want to go do. So you having like that very large corporate background and being able to like generate those kinds of contacts, what is your key to not only just networking, but being able to create high level contacts like the ones that you have that would be able to play out in a situation if you're looking to actually make some kind of business venture?
I love helping people. So I am working with a number of business owners that are just starting their business. And because I'm out and about a lot, I do make those connections. So I'll give you an example. I have one of my clients is a primary care concierge practice. And he reached out to me. He was still working as an internist at a practice. He said, you know what? I want to go and start my own practice. And so when he launched, I worked with him. Actually, pre-launch, I was working with him. I helped him hire his first employee. And then, which is interesting, a lot of physicians I've been helping do the interviewing, and it's very important because you have to be careful what you're asking. But I was working with him. We brought in an employee. And then I said, because I have the business background and I like to help people, is just thinking about the practice. And he said, okay, I have this many patients that are following me. This is how many I think I can support. And I started introducing him around to other individuals in a way that he could help grow his practice. And so roll forward a couple of years, he reached his goal. He had a waiting list. He wants to get people off the waiting list. And so we were looking and we were interviewing physician assistants and nurse practitioners to expand the practice. So it's just, talking through some of that. But he was the first time owner for his own practice, and then, thinking that through.
Wow. So you've been able to really curate a large network of people, and that you'd say it led to some part of the success. How would you recommend someone who's either just starting their career, because we do have career folks as well, or is in their youth in terms of entrepreneurship, going about being able to establish their own connections?
So I would say one is looking back to where they may have gone to school, if they have alumni, and reaching back out to the school and the alumni network, because alums do like to help other alums. So that's one way to connect. My daughter, actually, we were talking and she just joined a board. And I was so excited because I said, this is great experience. And, I've been on boards for all these years. And so that's another way, volunteering your time to be with other individuals and gain skills, which can help you in the future. Going to groups, I'll tell you, here's another example, meetups. When COVID started, there was a woman in my area that decided to start a meetup, which was brainstorming for nonprofits. Okay, I had been serving as president of one of the largest nonprofits here where I live. Plus, I have a lot of nonprofit clients, and so she had me co-run it with her. We had about a half a dozen individuals that were going in and out of our group that were just launching nonprofits, and really brainstorming with them and helping each other. And there are resources in the area. So for example, there are incubator programs. If someone is looking for resources and help or space when they're launching. Talking to other individuals who have their own businesses. So I'm always talking. I just met with a woman this week, and she's been at a company, and we talked through, she's in transition. Does she want to work as a consultant and an independent contractor? Does she want to go to a company, and really thinking through that? So over the years, I've spent a lot of time talking to other individuals, maybe mentoring people. And so just finding people that you can do that with. The chambers are a local way to meet people. So a chamber of commerce in your area is one way to go to events there. And there are a lot of other groups that, as I meet with people, I enjoy talking to them, seeing what their interests are, and then connecting them and saying, have you heard about this group? Maybe go visit that, or if you want to come as my guest to a meeting.
Wow. Like that. Okay. You guys are getting a lot of information today. You guys are, I should charge for the podcast, and you guys are lucky I don't. Okay, so I really want to dive into some HR stuff, super, really, really nitty gritty things, right? HR has obviously changed a lot throughout the time. We now see companies that are taking care of specific kind of small HR things like Gusto. There's certain online like HR platforms. I used to use Zoho for a little bit. What is something that someone should think about as they're starting to gain employees, or if they already have employees that they don't like really think about that might be that they should?
So one thing that we run into is they say, I'm too small, I can't offer benefits to my employees. I hear that a lot. And there are not a lot of consultants or brokers that say, I'm going to help these startups or small companies. I have, as I was telling you, I have an owner with their first employee. So one of the things we talk about is, do you want to offer benefits? So the owner may not need health insurance, but that may be a valuable benefit for the employee. So I have a number of companies that I have helped set up benefits. And what that does is that helps you to attract and retain employees that could work for a larger company and get benefits. So if you wanted that expertise, that is something that is important.
How much would it say potentially cost to be able to do something like that?
Well, I am licensed as a broker. I think I'm up to like 14 states where I can actually set up the like medical, dental, vision, life, disability benefits. So this physician that I mentioned, when I helped him hire the individual that was going to work for him, and we set up medical, dental, and vision benefits. He was somebody, he said, I'm on my wife's insurance, I don't need it, but it was going to be helpful for the employee. And then now we're looking at adding life and disability benefits, because once he's been in business for a couple of years, then a carrier would give him, at least a year would give him offer disability. The actual cost for the benefits will depend on the demographics of the group. So that was a bit more challenging. So when Obamacare or ACA was passed, what it did for small groups is the cost for health insurance is based on the specific people that are covered. So in the olden days, we always just had, we were given rates. It was based sort of on the average age of the group. And then if you had employee A or employee B and they wanted individual coverage, it was the same cost. That's not necessarily the case after Obamacare was passed. So the costs are less if you have younger employees than older. We can still, blend the rates. So if you want to use one rate for everyone. So it's
what's the numbers look like number wise? Like it doesn't have to be exact, but like
but the plans vary. So is it going to be, 300 a month? Is it going to be 500 a month? Are you going to have an HMO where you're restricted in a network versus a PPO? So it really varies quite a bit.
Okay. Let's say there was a virtual assistant company that had 5 employees, say ranging throughout the country, and they wanted to provide maybe at least just dental, health, and vision, the basic thing.
So what I would do is I would work with that company. I would work with the owner, because I do this all the time. And I say, okay, I need the information on your group. and I'm going to send it out for quotes. Okay, the quotes come back, and so it gives all the choices, because when you're small, it's a plan that's been filed with your state. So it's very specific on what, the carrier has filed this design with the state, and we get the numbers back. And we talk about what's your budget, because remember, this is the cost, but you're going to share the cost with the employees.
And is it, say, like a high level?
Cost.
What would you say is like the level of insurance comparable to?
The level, well, you usually have more choice for a group than you would as an individual. So the other thing that Obamacare and ACA gave us was the ability for any individual, regardless of how sick they are, to be able to get their own individual insurance through like the exchanges in the state. But the actual choices, you as an employer, you get to decide what you want to offer. And so say the plan was, going to be $300 or $500 a month, you may say, I'll cover half of it. But it's going to be up to you. And, do you want to cover anything for dependents? You may not. Do you want to cover 50% of the employee monthly cost? You pick a plan. You can offer a more expensive plan and let them pay the difference. So there are different ways that you structure it. So I work with my client and I'd say, budget is, your budget. And we have to work within your budget. So I'll give you an example. I had a company that for years had a plan and they had a health savings account feature on it. Okay. And they were putting money in, and I ended up switching them to a health reimbursement account. They saved $30,000 the first year. They had 25 people. So what I do is I like to think of it, I'm not tied to any specific carrier. I always look at everything from a consultative approach and custom, and really understand their needs and what they want. And I'll explain to them, if you're going to offer this, we want the employees to appreciate it, and they'll get their bang for the buck on it. So medical, dental and vision. Sometimes the employer doesn't pay anything for. If they're going to pay something, they're usually going to chime in on an employee cost for medical. Yeah.
That's a whole separate podcast I might have to bring back on to talk about specifically just HR benefits and how, because I've looked into it, and I think that especially for, like, say, small businesses, family offices, things like that, it's a great way to be able to just provide.
So that's an important way to attract and retain the employees, is if you can do benefits. The other thing that you can do this day and age is offer the flexibility for work. Okay, if you can accommodate remote work or hybrid, that's something that employees are looking for. They'll turn down jobs if they can't get that. So prior to COVID, employers thought they could not have remote employees, and then they had to flip on a dime for that. And so the employees have a good case if they were productive when they weren't there. So what's going to bring them back to the office? So if you're a small employer and you're requiring them to come to the office, they may not like that. So you have to work with that. So that's another thing, that flexibility is important.
Wow, we have been having, I love the conversation we're having, but one of the things that we always like to talk about before we have to depart with any kind of guest is, if you were to start over, all over again, what would you do differently?
What would I do differently? I think I tend to be a workaholic. So I always say balance is something to work on. And my model, it's worked for me, but maybe I shouldn't have done it this way, is to be fully accessible for my clients. And so I try, to always be accessible. So it's, not taking, the vacations and making sure I'm checking email and that kind of thing. So I think starting over there, or starting over and being HR and benefits from day one, because I found that, coming in and, the official name has benefits in it. Some individuals still were not realizing that we could provide broader services. So I think that would have been the thing I would have changed up front, was to not keep benefit in the name. And then the branding would have been a little bit easier. So now we try to focus more on CETA rather than the CETA benefit consulting.
See, would you what's the word I'm looking for? Hindsight makes things so much better. Oh my gosh, like blanking for a second. But no, this has been an amazing conversation. I think people have learned so much from this. If you've heard anything that you've liked, or if you'd like to work with Stephanie, where can we contact you at?
You can contact me here. My office, the number's 301-881-8883, or via email to S like Stephanie, D like David, K like Kevin, A like Apple, T like Tom, Z like Zebra, SDCats.CETA@gmail.com.
All right, just so you guys know, that information will be in the description. And I think we've had such an amazing time. We're gonna have to bring Stephanie back for, like, say, a part 2. We don't bring too many people back for part 2.
Okay.
Stephanie's definitely gonna have to be a return visitor.
Thank you. I've enjoyed it.
All right. You guys have been listening to The Ramblings, and that is the show.